So we had already published the primary results of the THALES trial, and showed that there was a reduction in ischemic events, but an increase in hemorrhagic events. And there was confusion about whether that balance and whether the balance was worthwhile, and the benefits outweighed the risk. And so we went back, and this is according to the regulatory authorities. They were requesting the same thing, and we disentangled the risk and benefit outcomes so that they were truly independent, made sure they were associated with long-term impact. And then we looked at them in absolute terms, so the absolute number that would be expected to be increased or decreased of those two events. And it was critical because people were confused about how to interpret the results. The original trial showed that the benefits were substantial in terms of reduction of ischemic events, and the risk of hemorrhage was smaller. And in the disentangled outcomes that we measured here, we found that was actually still the case. In fact, a little bit of a stronger effect, where basically we had a reduction of 4 major ischemic events for every 1 increased major hemorrhage. And that ratio stayed the same whether we used any disability or moderate disability or worse to look at those events. So there wasn't a difference in levels of disability between those 2 outcome events.